Well, a warm welcome back. It's still Tuesday, the 27th of July. Now, there's quite a lot of bemusement in the UK at the moment, but it's positive. Let me tell you what it's about. So here we have the figures that we looked at yesterday, and we noticed that the peak was on the 17th of July. There was 46,558 new cases on Tuesday, the 20th, but since then it's been going down. 21st, 22nd, 23rd, 24th, 25th, 26th. And we did say yesterday that the data from Sunday is often a bit behind, so that real number may have been higher. But the number for today, Tuesday the 27th of July, is 23,511. So we've got at least 7 days of continuous reduction now in the number of cases, and this is remarkably encouraging. Now, of course, the restrictions that were eased on the 19th of July, they're still going to be feeding through. We won't start seeing an increase in cases till Friday, Wednesday, Thursday, Friday. Another 3 or 4 days before we'll start seeing that. But it's remarkably encouraging. And of course, the increase that we do get as a result of the easing of the restrictions is going to be based on a much lower base of cases. So more on it in a minute. Anyway, let's just look at Scotland first of all. Now, Scotland, cases peaked in Scotland on the 1st of July. Fair enough. Hospitalisations peaked 2 weeks later on the 14th of July. So we notice this 2-week delay. So here we have cases and hospitalisations in Scotland. So this is cases that have been falling now since the 1st of July. And hospitalisations have been falling since the 14th of July with that kind of delay. So once the cases are falling, we can expect to see hospitalisations falling in a fortnight's time is the key message. And of course, thankfully, deaths have been fairly few, relatively speaking. And we would see that falling the week or so after the fall in hospitalisations. So that's very interesting. So Scotland's been going down for even longer than Scotland's been going down since the 1st of July. And the UK as a whole has only been going down since the 21st of July. So basically Scotland is about 3 weeks ahead really of England, which is they've done very well. So why is this? Is an interesting question. Now, I think that a big factor in this is schools. So basically, Scotland schools break up for the holidays the end of June, whereas the English ones, it's a good couple of weeks later. It's the 16th of July. And of course, when children are in school, in classrooms, they're going to be spreading the virus one to another, and they're going to be taking it home. So Scotland a good 2 to 3 weeks ahead of England in terms of reducing cases. And I think a big factor there could be that the Scottish schools started their holidays 16 days earlier than the English ones did. As well as that, in both countries, it's been absolutely great weather. So people are doing things outside. And we know that there's a lot of community immunity as well. But a lot of outdoor activity can only be good for reducing the spread of the virus. So we've got these factors that aren't fully understood, and we've got this interesting delay. Now, the other factor there is the football. Part of the increase we had last week could have been the Euros, particularly in England, of course, because England got to the final, whereas the Scottish team went out a bit earlier. So people in England were meeting in pubs and watching big screens for much later than they were in Scotland, which could be another factor in the delay. So I think the two big factors there are the schools in Scotland breaking up earlier and Scotland going out of the Euros earlier. I think they're probably the big factors there, because of course the good weather has been in both countries. Now, if you're not in the UK, you won't realise, but the last few weeks have been the most incredible warm weather. I mean, Scotland's actually been hot. I mean, it's just incredible. So that is certainly helped, but of course that's helped in both countries because the weather's been good in both countries. The rain's only started in the south of England in the last couple of days. In fact, here in the north of England, it's not raining yet. I'll just show you out the window. The weather's actually still fairly good, I am delighted to say, although the ground at the allotment is getting very hard. Now, the Prime Minister, Boris Johnson, basically, you've got to say he's somewhat bemused by this by this great improvement. So, direct quotes: "We have to remain cautious, don't want to come to premature conclusions. Still a dangerous disease, all true." All true. But he's obviously delighted. Now, the Prime Minister himself has just come out of 10 days isolation, actually, after being exposed to his... it's not funny. After being exposed to his Health Secretary, Sajid Javid, who we believe exposed the Prime Minister and the Chancellor of the Exchequer as well. So presumably Rishi Sunak is now out of isolation as well, which of course is good. Now, quite a few people in this country have been told, who work in food logistics, that if they get pinged, they can be released back to normal duties without serving their 10 days isolation as long as they test negative. But that's very limited at the moment. The Prime Minister wants most people to carry on isolating for the 10 days, but the test to release is going to start on the 16th of August. So after the 16th of August, if you do get pinged by the COVID symptom tracker, the NHS COVID app, you'll be able to test to get out of isolation after the 16th of August, but not until then. Now, Professor Neil Ferguson, whenever I mention poor Professor Neil Ferguson, he does get a bit of a negative press, but he is a member of the Scientific Advisory Group for Emergencies, and the government does listen to him. Okay, his models haven't always been bang on in the past, but that's not his fault. He just puts the numbers into the models. It's the models that are at fault. He just reports on the models. So, yeah, we need to improve the models, that's for sure. Anyway, he's in stage, so that's fair enough. Direct quote: the effect of the vaccine is hugely reducing the risk of hospitalisations and deaths, which we know, but worth reinforcing because it's remarkably good news. And I'm positive that by late September or October time, we will be looking back at most of the pandemic. So he's thinking things are going to be largely getting much better by September or October. Now, I'm going to put a question mark on that because, of course, September and October, the weather takes a bit of a nosedive in the UK, and that could be a factor. That could be a big factor. So it could be being optimistic there, but that's okay. Normally it's pessimistic. We will have COVID with us, and we will still have people dying from COVID, unfortunately. We will have the bulk of the pandemic behind us. But too early to be sure. He said he's happy to be wrong about the figures, which are going in the right direction. We're not completely out of the woods, but the equation has fundamentally changed, he says. And the sun's come out and my letters have gone a bit light, but never mind. I'll read it out for you. He says, clearly, the higher we can get vaccination coverage, the better that will protect people and reduce transmission. But there is going to remain uncertainty until the autumn. So there you go. He's not quite sure why he was pessimistic either. Now, having said that, the cases will be going up next week. So as of Friday, we're going to start to see the effect of the reduction of restrictions. That's going to come in from Friday. But as we said, not everyone's going to rush out to nightclubs the very first day that restrictions are eased. We'll see these effects coming in over about a week or so. I mean, I haven't been to a nightclub myself yet since the restrictions were eased. In fact, I haven't been to a nightclub since 1983. But that's a slightly separate matter. So summer, at least for the next few weeks, is looking pretty good, although we will see an increase in cases, but hopefully this disconnect between cases, hospitalisations and deaths will just get stronger as more and more people get vaccinated. Now, I've got a couple of video reports for you. The first one is from Luke, who's in Tokyo in Japan. So let's just remind ourselves of the situation there. So Japan, definitely going into a third wave here at the moment. And of course, this is associated partly with the Olympics. I mean, the Olympics is a bit surreal, really. We've got the Olympic Games, but there's no one watching. Anyway, let's get this report direct from Luke in Tokyo. Thank you very much, Luke, for your report.
Hi, John. Just thought I'd give you a quick update on the situation here in Tokyo. I'll try to keep this as concise as possible. Firstly, the good news. Most people are still wearing masks, I would say around 9 in 10 people. And that's despite the really hot, humid, nasty weather outside. We're seeing some days with the 41 degrees on the feels like charts. So being outside even without a mask on is bad enough. When you're wearing a mask, you feel that sweat building up. You feel the area around your mouth getting kind of gross. So it's impressive that people are still sticking to masks the way they are, me included, of course. As for the vaccinations, I believe something like 22% of the population has been double vaxxed. So the older population are getting quite well protected now. However, the bad news comes in with the new case numbers. We've just had a new record of 2,800 infections today, and that's out of around 14,000 tests, I believe. So that's something like a 19% positivity rate. It doesn't sound like a lot, but you have to remember that Japan's testing numbers are really low. They've only tested something like 18 million people since January 2020. So if you compare that to a country like the UK, which has half the population, it's just kind of bafflingly low. And we're seeing some days with over 25% positivity rates, because on holidays and weekends the test numbers can be as low as 3,500. So it's, coronavirus doesn't take a day off, so you'd think there would be more testing done on holidays and weekends to constrain this virus, especially this new variant. And some of the other bad news is that I do check the age demographics sometimes of the infections when the reports get released, and there's been a really big uptick in cases among 10-year-olds and under, as well as the 11 to 19 bracket. Of course, 20s and 30s are leading the infections overall, but there's been a significant uptick in cases in the teens and younger, and it's quite surprising because in the past there's been so few cases in those age groups. I'm not sure if this is a Delta-specific issue, or if it's just because they've started testing younger people, or really young people, more than in the past. That's something I can't really speak to. As for restrictions, the restrictions here are, I don't want to say non-existent, but they're not strict at all. And in a way it's a good thing, but also a bad thing, because the restrictions that are in place just seem to be a little bit daft to me. For example, I can go all day around Shinjuku, busy shopping areas. I can go to Starbucks, I can go to IKEA, I can spend all day in places like those, around so many people. But I can't go to a 7-seater bar after 7 PM or so and have a drink. And you can't order food in restaurants or alcohol in restaurants after around 7 PM, because around 7 PM there will be last orders. So you can do basically anything you could do before the pandemic, except drink past 7 PM or so and order food after 7 PM in restaurants. Those are by far the most harsh restrictions, and if you were not really paying attention to the news or anything, it would be almost like there is no pandemic going on here. You would just notice the lack of tourists and the uptick in mask usage. Anyway, I don't really want to complain. I'm having a good time here because I've been able to work from home since February 2020 or something like that, which, it's coming up to 2 years soon enough, and that's kind of crazy to think about. But yeah, it's just a strange situation where there's a pandemic going on, but it doesn't feel like there is one going on sometimes, even though, of course, there certainly is. Anyway, I'll leave it there, I think. So thank you for listening to me, and thanks for the news updates, and I hope you're doing well back home in the UK. Take care. Thank you.
Well, thanks for that, Luke. That was very interesting, very concise. I just can't work out why the Japanese, it's a sophisticated scientific country, why they don't get their act together on testing. The thing that's concerning me there is the high positivity rate. That means that the number of cases that are being reported is clearly down because of the lack of testing. There is a high positivity rate, which is a concern. So if we just remind ourselves there of the situation in Japan, we know that this is a significant underestimate now from what Luke has said. Now, I'm going to go another report actually from Aidan in London now. Now, we did talk quite a lot about this. Basically, the thing is in Australia, in Israel, sorry, in Israel, there seems to be some intimation that the protection for the vaccines is wearing off in terms of people getting infection and people getting symptomatic infection, even though it's minimally symptomatic infection usually. Thankfully, not a waning off of protection against hospitalisations and severe illness. But of course, quite a few people, including Aidan, have been pointing out, yeah, well, fair enough, but Israel was way ahead of the UK because there's a big time gap here. So I think these are the kind of points that quite a few people have made, and Aidan's summarised this for us. Now. So Aidan's interesting. He's a nurse in London, but he actually got what he thinks to be basically a long COVID since back in February 2020. So I know he's been following things with great interest, and he's been a long-term viewer of this program. So Aidan, looking forward to your views now and your analysis of this situation. Thank you very much.
Hello, my name's Aidan. I live in London. And just a few thoughts on John's video yesterday about waning immunity from vaccination in Israel. And this is really big news. There's very big implications from it. And I wrote down a few thoughts. John asked me to put those on video, so here it is. The data's about Pfizer, but it's also probably, almost certainly about Moderna as well, isn't it? And how many countries are using Pfizer, and how many countries are you doing 12 weeks like UK? I think almost everyone's been doing 3-week gaps, which just seemed like a really strange decision to John, and well, felt like a really strange and unfathomable decision to me. And it just from getting more people vaccinated as soon as possible. I had the Oxford AstraZeneca's jab, and it gets a lot of bad press, but I think it's great. It's remarkably effective, and maybe it's too cheap. Maybe that's the problem with it. I'm not sure, but I remain really glad and grateful to have had it. And the little data we have seems to show immunity increasing after, over time after you've had the AstraZeneca jab. So hopefully that's happening with me. Right, UK data, symptoms. There is a big problem with the UK data in that the symptoms don't match the symptoms. If you go on the website and try and get a test, the symptoms don't match the actual symptoms you get from COVID-19. So, one, that's mad, and two, that's going to lead to underreporting of mild cases of COVID-19, obviously. So that could be some of the data discrepancy between UK and Israel right there. The other thing is that in Britain, everyone has colds. I mean, you don't need to live in Carlisle or, it's just sort of cloudy and rainy all the time. So you've got colds and hay fever and stuff all the time. I've never been to Israel, but I would work on the assumption that there's less colds and less flu going around in Israel. So the symptoms would tend to stand out more and people would tend to get tested more. Whereas in Britain, you just think, well, I've got a cold this week and I had a cold last week, and I'm not, and then I was well at the weekend, and I think there's a tendency not to get tested and to think, well, I'm not ill, so it can't be COVID. So, and there's just mild symptoms, and and then the next day you haven't got the symptoms. So, was it or wasn't it? It's hard to know, isn't it? Now you were saying about there's a big difference in mild symptoms, mild illness, but hospitalisation was much closer at 96% versus 91.4%. Now, to me, that looks like 8.6% of people are in hospital and 4% of people are in hospital in Britain. So that is a huge difference. It isn't a small difference. You were saying, well, it's a small difference, and it's double the number of people in hospital, over double. So that's really quite big, isn't it, in hospitalisation? Now, the case for vaccination has always been strong. It remains strong. Perhaps it's even more strong now. If anything, it's the illness looks like it's going to be endemic. I know you did videos where you're saying you're hoping that it's not going to be endemic, that we can get rid of it. Do you still feel that, John? Because I'm beginning to think that it's of the two paths, it's going more towards being a cold. Sort of slowly changing into a cold as more and more people have had it or had vaccinations. So I'm just wondering where you are on that. But that being the case, seeing as it's endemic, it makes the case for vaccines stronger, because it does look like over time close to 100% of people, perhaps everywhere in the world, will have some sort of immunity from either vaccination or getting ill, or some proportion of those people will have died. So vaccines remain remarkably safe and effective. The only questions with young people is that the vaccines aren't dangerous, but there's a lack of risks from the vaccines, but there's also a lack of risk from COVID for very young people. So we have two sets of twins who are 5 years old and 7 years old, so I can't, I'm not envisaging getting those vaccinated anytime soon, just because the risks are so low. So anyway, just finally, thank you so much for all you've done over the past, since January the 26th, 2020. I started watching stuff in early February, and it very quickly became clear from you and other people like Medcram that this, that it was definitely happening, and it was the big pandemic that we've all expected for a while. So thank you for being. I mean, I've never met you, but you feel like a trusted friend. So thank you very much for that.
Aidan, thank you so much for those kind words. It's kind of a unique thing, really. You watch people on videos and you do feel like you know them, and it's and of course, I guess in a sense that you do. I mean, I feel I know you partly just from watching that short video now. And we were both you still are a psychiatric nurse. I was in my youth. So thanks for that report, Aidan. Some excellent points there. And interesting that people are thinking about it and coming to similar conclusions. Now, you asked me the question there, do I think it's going to become endemic? Tell you what, before we do that, we'll just mention, I'm not dodging the question, honestly. Before we do that, we'll just look at what you mentioned there. The reason I ducked off there was to get these figures. So people that have had 2 doses of the vaccine, the last Tim Spector figures. A runny nose is the most common, then a headache, then sneezing, then sore throat, then loss of smell. As you say, typical common cold features. I mean, thankfully, there's been fewer common colds around over the past few weeks, but there's been huge amounts of hay fever. And of course, runny nose, headache, sneezing, easy to miss that. That's why we have to have this high index of suspicion and get tested if we have these symptoms, so as not to pass it on to someone who's at greater risk, someone who's not responded to the vaccine, someone with comorbidities, or indeed someone who hasn't been vaccinated. And this is unbelievable. Last time I checked, it's still not reflected in the government website. What are you playing at, government website? Get your act together. Come up to speed with the current clinical features that people are actually getting. This isn't 14 months ago. This is now. Come up to speed. Unvaccinated, slightly different features now, but again, different from the initial features. So headache, sore throat, runny nose, fever is only the third there, and persistent cough. So the fever and persistent cough, of course, we're familiar with. The anosmia we're familiar with. But we're not seeing the shortness of breath in the acute phase. Now, the shortness of breath will still occur, of course, in the second inflammatory phase, but we're not seeing it so much in the acute phase now. So Aidan is absolutely right about those about that change in symptomatology that's not reflected. Now, getting back to the idea, will it be endemic or not? The reason I was hopeful, mostly the reason I was hopeful that this would not become endemic, was that we eradicated SARS coronavirus 1, 2002, 2003. But as you correctly say, Aidan, the symptoms changing and it's becoming more of a common cold and it's circulating around people that aren't getting sick. Now, Paul Hunter was on this channel a few weeks ago, and he tells us that one of the coronaviruses that we have now, one of the 4 common cold coronaviruses that we have now, started, I think it came from cattle in an outbreak in 1890, I think he said. So that is quite conceivable. It is quite possible that this virus could become endemic just as a common cold. Yes, and that is the majority view of epidemiologists and virologists, that this is going to become endemic. I think what we can certainly say, as Neil Ferguson's just saying, it's going to be here for a while, certainly several seasons. But I still feel there's the possibility of enough people around the world developing enough immunity to this virus that it will stop spreading and could potentially die out. Now, I agree the most likely thing is it becomes endemic and we have it for several decades or 100 years into the future. That's quite possible. But I remain hopeful that, although we're certainly going to have it for a few seasons, that it may well not be here in 10 years' time. Of course, we're not going to know that for 10 years' time. But I agree with you completely. The majority of opinion now agrees with you, Aidan, that this is likely to become endemic, albeit with immunity and irritating symptoms in the vast majority of people rather than dangerous symptoms. So thanks for that, Aidan. Appreciate it, and thank you for watching for such a long time as well. And thank you, of course, for watching this video.